Welcome to today's webinar, Diet and Skin Health, brought to you by the Almond Board of California. Thank you for joining us. My name is Swati Kalgaonkar, and I'm Associate Director of the Nutrition Research Program at the Almond Board of California. Before we get started with the webinar, there are a few housekeeping details to cover. During this webinar, all attendees will be muted. If at any time you have technical issues, please access the help screens at the top of your attendee control panel. If you have questions, please type them into the Q&A box. Please do not use the chat box, and they will be answered at the end of the presentation. The session will be recorded. 1 hour CEU has been approved by the Academy of Nutrition and Dietetics. These are the learning need codes and suggested performance indicators for this webinar. And with that, I'd like to introduce you to our esteemed speaker, Dr. Raja Sivamani. Dr. Sivamani is a board-certified dermatologist, as well as an Ayurvedic practitioner, and hosts the wellness platform GVOM, and has 2 clinics, Pacific Skin Institute and Zen Dermatology. He's the Director of Clinical Research in the Department of Dermatology at the University of California, Davis, and he is the co-director of the Microbiome Research Initiative at the California State University, Sacramento. He focuses on general and integrative dermatology, including medical, surgical, and cosmetic services with training in bioengineering, allopathic, and Ayurvedic medicine. He merges modern research and science with a personalized approach to each patient. His training in Ayurvedic medicine lets him take a more humanistic approach to patient care, science, and research. Dr. Sivamani has over 110 peer-reviewed publications and a textbook on cosmeceuticals. He leads many clinical studies that focus on the impacts of foods, nutrition, the microbiome, and the gut-skin axis, as well as studies on standard Western medications and devices. Finally, he is a deep believer in integrative medical education and one of the main editors for LearnSkin.com.
Well, hello, everyone. My name is Dr. Raja Sivamani. I'm a dermatologist, integrative dermatologist, and I have a deep passion for looking at integrative approaches, including nutrition and botanicals and how whole foods might impact our skin. And today I really wanted to spend some time talking to all of you about diet and skin health. And it ties in really closely with this whole new trending area known as the gut-skin axis. So I wanted to talk a little bit about that too, but really we'll be focusing in on whole foods and some of the emerging science that's coming out of the clinical trial literature as well. So these are my disclosures before we get started. And the objectives for today is to give you a background on photoaging and then how the gut might tie into the skin. What are the communication pathways that are there? And we'll take a real focus on nutrition today. So we'll look at nutrition in the skin. I'll give you a little bit of background. Then I want to talk to you about some really interesting results that come out of a recently published almond study that we had run. But to start with, when we look at photoaging and we think about the aging process, we have to realize that there are multiple molecular pathways that are getting upregulated, and at the same time, they're tying into clinical appearances and physical changes that we all know are happening. And the whole goal here is to think about how can we truly be preventative instead of being early reactive? How can we really get ahead of this curve? And so that it's not about anti-aging. I mean, we're all going to age. We have to embrace that. But how do you age healthy? How do you do healthy aging and aging well? So when you look at it from the molecular perspective, there are melanocytes, which are the pigment-producing cells on your skin, and they become much more active. And they become active in irregular patterns, so that can cause, and we'll talk a bit more about that, but they'll cause irregular areas of pigmentation. Collagen starts to degrade, and there's oxidative stress from many different sources, including internal and external, and we'll explore that. There's a really interesting twin study that I'd like to show you. And what this translates into is that you get clinical changes with wrinkles, dyspigmentation, which just means uneven pigmentation, leathery skin, loss of texture. And if you look at the images in the top, you can see that there are subtle changes going on for aging. And then over time, these changes take hold more and more. And the idea is not to, again, impede this to zero. You can't, but how can you do this well? So one of the first things that you might or might not realize is that this is happening even before your visible eye can catch it. So here's a woman who looks relatively even. You look at her skin and you might say, gosh, her skin looks very even. When you look at it under a UV lamp, it's a different story. You have a battle that's going on underneath the visible skin layer. So when you look at the UV, a kind of exposed photography, you can start to see dyspigmentations already starting to emerge. And the idea is that before your eye can see it, your body's already starting to undergo changes. And so can we get at that earlier? And so then what ends up happening is typically you have what's known as the upside down triangle. So if you're looking at the cheeks are much more prominent, and then the chin and what we call the jowls on the sides of the chin are not as prominent. And so you have a triangle that points downward. Unfortunately, with aging, what ends up happening is you start to get much more filling of the jowls, the skin starts to hang down, and that's natural. It's going to happen because gravity has been working on the skin for a long time. It's losing elasticity, and then over time what you get is much more of a square, or what we call a right side up triangle. So with aging, some of the changes that we alluded to that I wanted to point out that can happen over time is that you start to get changes in pigmentation. You can see here on the cheeks that it's not as even anymore. There's deeper wrinkles that are now set in, the finer lines around the eyes, under the eyes, over the upper lip, mid-forehead. Those are much more prominent. You get a little bit of loss of elasticity under the eyes as well, so you get the bags under the eye. And then you get much more redness. Now, you may have a little bit of rosiness that's here, but what happens is that it becomes much more prominent and fixed, and they don't fluctuate as much. And you can even see here under the darkness that's there, the uneven pigment, there's also redness. So really, when we think about aging, there are four main things that we look at. Of course, there are other things when you look at it molecularly, but from a clinical perspective, you have fine lines and wrinkles, redness, skin tone changes, and texture changes. And the texture changes are a really important one as well, because when you think about texture and how even skin is bouncing light off of it as it's being viewed, it's very different as you start to age because you have micro variations in the skin. You don't get that even shine that comes back. Sometimes a lot of people will say, oh my God, my forehead's so shiny, and I really don't want it to be this shiny. That we understand as dermatologists, that people have oily skin and less oily skin. But what we unilaterally see is later on, people say, oh, I'm getting a duller appearance to my skin, and that duller appearance is many times a loss of texture and a loss of smoothness. And then they wish for those days when they had a little bit of shininess to the skin. When we think about, can we influence aging from our habits? This is a very interesting study where we looked at twins. And, well, it wasn't us, but we as a human population, when we do these studies, I always feel this connection to other clinical scientists. But this was a study that was done looking at twins. And can you guess which twin was a smoker and which twin wasn't? Well, if you guessed the right-hand side, you're correct. If you look at these two gentlemen, the twin on the right was a smoker, and you can see much more deeper set wrinkles. The texture is very different on him, and he has a much more aged face, perhaps actually a bit more extra bags under the eyes as well. And then if you look on the right, clearly much more pigmentation changes, much more deeper set wrinkles, and the fine lines are much more obvious as well. And so the overwhelming answer is yes, you can influence aging, and you can influence the way you look. And especially when you're a smoker, that's just tremendous amount of oxidative stress that's coursing through your bloodstream and then getting to all your tissues, in fact, but especially the skin. So let's talk about the gut-skin axis. Now that we know that we can actually do something about how we age, can we do that from the inside? The microbiome, as we know, is so rich, even on the outside of your body, but definitely on the inside of your body, it's very rich too. We all think about the gut microbiome and the skin microbiome. Just want to motivate the fact that although we're not spending time talking about the microbiome in detail, a lot of the research is heading in that direction. So I wanted to give you a tiny overview just to tell you that the gut microbiome does have influence on the local immune system and also how it communicates. And so our question is, how does the gut communicate to the skin in general, and how does that impact how your skin may appear from a health perspective? Well, there are four main mechanisms, and of course we're going to keep uncovering more and more. That's just the nature of this. So I expect by 1 year from now, there'll be much more things that we can add to this list. But by and large, these are general concepts, and the idea is that if you eat something, you are going to directly absorb it. It is going to then get into the bloodstream and get to the end organs. And in this case, if it's the skin, it will get to the skin and do its action. We see this in many cases, and this used to be the only way we used to think things would act. And our understanding of this gut-skin axis has totally changed. And now we know that there's modulation of immune system players down in the gut, because the gut is very rich in its immune education and the way that the immune system then interacts with the rest of the body after it gets educated at the gut level. There's also hormones. We know that if you eat certain things like high glycemic index foods, you're going to spike insulin as one example. Another example would be if you eat things that have just exogenous hormones like a lot of estrogens in them, or if there's a lot of testosterone in there, as long as it can get past the stomach acids, it can absorb and then do some actions in the body as well. And then what's been really the emerging area is signaling from the gut to the skin has been this notion that the microbiome players can release factors that can then get into the rest of the bloodstream and then impact other health outcomes elsewhere. And so some of the things that we've been looking at are short chain versus long chain fatty acids, lipopolysaccharides, and this is a rich area of research, and I'm sure that there's going to be much more coming. But I will tell you, one of the really interesting things about this area is that things like food, probiotics, prebiotics, herbs, all of these are influencing these factors, especially short chain versus long chain fatty acids. And then lipopolysaccharides is just a reflection that if you have certain gut populations, they may shift and release different factors that may be less or more inflammatory. When we think about the gut-skin axis, one of the questions I get all the time is, does the bloodstream actually talk to the skin? We know that the gut talks to the bloodstream. It's richly vascularized down in the intestinal area. Well, it turns out the skin is richly vascularized as well. It's not at the very superficial level. There's an epidermal layer where there is no blood vessels that are penetrating into the epidermal layer. And this epidermal layer is really a skin barrier. It turns over constantly. And so the body was smart. They didn't put blood vessels up here, or else you'd be bleeding out all the time. And that's obviously not going to be very useful to protect you. But in the dermal layer down below, there's a rich array of blood vessels, and they speak very intimately with several features of the skin, namely the sweat glands and the sebaceous gland. So if you look at the sebaceous gland here, it is right along the hair follicle. That speaks to the bloodstream and then secretes up onto the skin. And then you have two types of sweat glands, the eccrine sweat glands, which are found everywhere, and then the apocrine sweat glands, which are found primarily in the areas where you have skin folds, like the armpits, as one example. And so you do have ways of getting things to the skin. Now, the time course is different. If you're looking at the sweat glands, things move into the sweat glands and move out to the skin much more quickly. And we know this even with medications that we prescribe. We know that if you prescribe, for example, there's several antifungal medications that we can prescribe, and we tell our patients, go exercise in 30 minutes, because then that will get the medication to go into your sweat glands and get out onto your skin. The sebaceous glands are a little different and very interesting when you think about things like vitamin E or any sort of lipophilic molecule that you need to get into the skin, that you're trying to get into the skin and then enrich the skin surface with. That can take week time courses, and I'll show you some data around that. So let's talk about nutrition in the skin. Now that we've established that there is a gut-skin axis, talked a little bit about what are those mechanisms, let's think about actual nutritional players and how that might impact the skin. So when you are connecting the nutrition concept to skin, we start thinking about a whole different array of possible players. So some of the phytochemicals that are involved that I'd like to talk about today are carotenoids, and that include lycopene, beta-carotene, astaxanthin. Herbals are another player that can connect from the gut to the skin. Vitamins that are important, niacinamide, so that has been shown to be impactful in areas of photoprotection. Not that it protects you against actual sun, it's not a sunblock, but you'll see that it can enhance the ability to repair DNA. And so that's a very interesting study that I'll show you. And then while we have all these supplements and we break apart the foods into their components, what about whole foods? That's where we'll talk about almonds as well. Let's start with talking about astaxanthin. This is a carotenoid that's commonly found in marine sources. And astaxanthin was studied for, well, let me just back up by saying astaxanthin is a carotenoid. And we know that carotenoids, when they're ingested, for some reason or another, they will hone to the skin and they are exceptional antioxidants, and they've been thought to be helpful in augmenting photoprotection. And so that's what this study looked at. The study looked at people taking astaxanthin 4 milligrams daily, and what they found was, and what I'm showing in these two panels, is how people responded to either placebo or astaxanthin. And this was before they were exposed to UV light, and then after. And the question that you ask, and this is done in a very controlled fashion, is can you shift the minimal erythemal dose? Minimal erythemal dose is very important because it reflects how quickly you get damage from the sunlight. And the way it works is before a sunburn, when you get exposed to a certain dose of sunlight, if you hit a critical point, you will start to turn red, and that's called a minimal erythemal dose. And you can see here that the minimal erythemal dose, the change in the MED, there was an increase by about 10% overall. And one of the factors when it comes to MEDs is that when you think about sunscreen and you're using different sorts of levels of SPF, SPF is also impacting MED. So the idea that you could orally ingest something and further impact MED, remember, when you do habits that are important like sunscreen and then you add on foods, those aren't necessarily additive. Many times they can be multiplicative. And so if you do something like a boost of 10%, that's on top of whatever you're doing to your sunscreen. So if your sunscreen is already giving you a boost of about, say, you're protecting your skin by 5 times, and you add 10% to that, that's 5 times the extra 10%. So that's why we think these sorts of studies are interesting. But the other important factor to take away from this is that astaxanthin on its own is not going to be that protective, right? It's combining with other habits, but you do boost significantly if you combine with other healthy habits as well. Another herb that's also involved in sun protection, and I wanted to spend a little bit of time with sun protection before we talk about photoaging, other aspects with whole foods, because sun protection is very important when you think about photoaging. Polypodium leucotomus is a fern that can be applied topically, but it's taken orally for photoprotection as a dietary supplement at 240 milligrams 3 times a day. And what they found in this study was that increased the MED by about 3. So that's a 3-time boost in the SPF. And again, this is important to use with other sunscreens. You might say, oh, SPF of 3, that's not that much. But if you take that along with another SPF 30 sunscreen, now you're really giving yourself a boost. And so you want to always combine this with other healthy habits, but pretty interesting. Okay, now let's shift our attention to herbs. Turmeric is a very popular yellow spice, widely in Indian Ayurvedic medicine, probably the most popular herb that comes out of the Ayurvedic medicine tradition right now. And what we did was we did a 1-month study where we looked at, can turmeric impact redness on the face? And what we did was we used high resolution photography to track people before and after as they took and there were 3 groups. There was a placebo group, a turmeric group, and then a combo group, which was actually the interesting group. So I'll talk about that combo group in a second. But we looked at, does turmeric, because it's considered to be anti-inflammatory, can it reduce redness on the face? And what we found was, and I'll walk you through the data here, what we found was in the placebo group, not really much change. In the turmeric group, it turned out if you just took turmeric on its own, we didn't see much change either. But then this combination group actually did come together and it reduced redness by about 30%. Now, redness obviously is another feature that we try to reduce when we're thinking about healthy aging. Some people just are very, very reactive and their face starts to get red over time, especially if you haven't done very well with sun protection. So let me show you what was in the combo group. The combo group had turmeric in it, but it had a few other factors in there. And at first glance, you might think, oh gosh, this is just a mix of herbs in here. And so I'm an Ayurvedic practitioner as well, and I just wanted to walk you through how this herbal combo is put together, just to motivate the fact that, you know, when you look at other forms of medicine or other forms of health perspectives, they have a method too, and we don't want to just take one little component of how they do things, which is what we do when we just pull turmeric out of the mix and then use it on ourselves. Sometimes, you know, turmeric has benefits, but in this case, this combo, the way the combo works is you have certain herbs in here, anantamul and brahmi and amlaki and licorice are all known as adaptogenic herbs. And they're adaptogenic because they can help boost the body's ability to protect itself. That's the science behind it. that's the, I should say, the understanding from Ayurvedic traditions. And then you have manjishta, neem, turmeric, and then you also have boom amlaki and Phyllanthus amarus. And so all of those are much more of what we'd say anti-inflammatory herbs. And so when you put these together into a formulation, the idea is that you are now really impacting the ability of the body to potentially have protection. Now, obviously, you have to put this through a clinical study, but the idea here is that instead of just taking one herb, if you put the herbs together, then what happens is that you have a synergistic effect. And so this is something that you'll probably start to see as you go along. The reason I really wanted to spend time on these results was that I wanted to show you that there's a way that you can combine herbs, and it's not just random, and there's actually a thought process. And so when you're looking at other studies in the future, just think about what tradition was it coming from, whether it's traditional Chinese or whether it's Ayurvedic, and think about, oh, how did they combine these, or what were their approaches? And if you ever review any manuscripts, if any of you are reviewers, ask that of the reviewers. Ask them to explain why they put their herbs together the way they did. Okay, I want to move on to some other really interesting stuff and get to whole foods. So niacinamide, I told you, was very interesting in photoprotection, especially when it came to things like precancers and skin cancers. So turns out there was a study published in the New England Journal of Medicine where they had people take niacinamide 500 milligrams twice a day. And I just want to make a really important note. It was niacinamide and not niacin. Niacin will make you flush, and the people that take this are very uncomfortable. So if you're ever talking to people about niacinamide, make sure you emphasize that it's not niacin, it's niacinamide. And this was a study in people that already had been struggling with precancers and non-melanoma, not melanoma, but non-melanoma skin cancers. And what they found was, if you look at change from baseline, the people in the placebo group versus the nicotinamide group, the nicotinamide group had much lower counts of precancers as they went along over a 1 month time frame. And that just goes to show that if you're going to take something, it's not that you get the impact right away, but for things like precancers or if it's like skin cancers, you obviously have to take these supplements over a long period of time, but this is over a 12-month time course. And they also looked at a couple other things. They looked at how did this impact, so this is precancers here, these are known as actinic keratoses. When you look at skin cancers, they're looking at specifically non-melanoma skin cancers, which includes basal cell skin cancers, so basal cell carcinomas and squamous cell carcinomas, which are the most prevalent cancers that people have to struggle with, especially if you are sensitive to the sun, have lighter skin, Irish skin, or you've sunburned quite a bit, that increases your risk. When people were put on this intervention, what they found was it was protective against all non-melanoma skin cancers over a 12-month intervention period. So you might get someone that says, okay, I took it for 12 months, now I can stop, I got the benefit that I needed, and they had people stop, and then they followed them for 6 months afterwards, and guess what happened? Went back to how they were before. They started having their skin cancer show up again. So the point here is that if you're going to do something preventative or going to do something that's dietary, it's a lifestyle change. It's not a diet. It's not a fad. You want to really commit to it and make sure that you keep going with it. So let's shift our attention to vitamin E before we transition to whole foods. Vitamin E is a really important antioxidant system. It's naturally found in the skin, and we know that it has several impactful functions that are important in protecting us from DNA damage and from UV damage in general. We know that especially when it comes to UVA. Now remember, when you look at sunscreens, that's UV, especially SPF, that's UVB protection. But when you're looking at UVA, and they split UVA as UVA1 and UVA2, and they look at UVA1 in this particular study, which is important because UVA2 gets a little bit of protection from SPF numbers. UVA1, SPF tells you nothing about UVA1, and that's why you have to look for broad spectrum. So returning our attention back to vitamin E, when you look at vitamin E, you can see that when you're exposed to UVA, especially at the cellular level, you can see that the inclusion of vitamin E in that environment protects against oxidized purines, against CPD, both at low and higher levels. And these are both changes that occur in the DNA. They're DNA damage markers. And then if we look at what our vitamin E is like in the body, we do have it naturally. And you might say, okay, we already have it naturally. We're good. Why do we need to augment? Well, here's the reason why. if you look at the left-hand side for starters, and this is looking at alpha tocopherol and then gamma tocopherol, and of course, the amounts of alpha tocopherol are much higher, and you can just see that from the graph, but naturally we know that alpha tocopherol is much more prevalent in the skin. If you look at the black bars, these are people that have not had any exposure to sunlight. The white bars are exposure to 0.75 minimal erythemal dose. If you remember from before, minimal erythemal dose means the minimum amount of dose so that you turn red. So 0.75 means that you haven't turned red yet. You don't even know that you're getting close to burning. So you're not there, you're just outside, you're enjoying yourself. Maybe you're enjoying yourself a little, you're getting a little close to turning red, but you're not there yet. Well, here's what happens to your vitamin E levels. When you look at tape strips, which are basically taking strips of tape off the surface of the skin, and how they do this study is they'll tape strip up to about 20 tape strips, and what this means is number 1 and 2 is the very, very superficial part of your skin, and then you go deeper and deeper and deeper, and we know that vitamin E tends to be much more prevalent in the deeper parts of the stratum corneum, which is the dead layer of skin on your skin surface. And what you see is as you go in further and further, first of all, they established, yes, vitamin E is much more prevalent. That we already knew. But the experiment part of it is that look at the vitamin E levels in the people that got 0.75 exposed to the to UV light, meaning they didn't get red, they just got exposed to 3/4 of the way to getting red. You can see there was a lot of drop-off in the vitamin E levels that would have been there, and almost a 50% reduction. And if you really think about it, and then look on the right side as well, same thing with gamma tocopherol. If you really think about it, this makes sense because you don't just go from 0 to burning. What happens is there is an evolution to how the sun is impacting your skin. And that evolution is that you are depleting your antioxidants over time. And this is the whole idea of why it's important to augment with foods and supplements to protect the skin. And it has to be a commitment because this is happening and ongoing all the time. So you should rely on your natural antioxidant system, of course, but then you should also augment it. So when we think about where is vitamin E enriched, and we think about where it's enriched on the body, it's clearly enriched on the face. If you look at this left graph here, looking at the cheek and forehead, and then you also look at the upper arm, so you have the cheek, the forehead, and the upper arm for alpha tocopherol and gamma tocopherol, and also if you look at squalene, you'll see that the amounts of these vitamin E levels are much higher on the cheek and forehead, and the reason for that is you just produce more oils there. You produce more sebum, and vitamin E is lipophilic, and it's transferred to the skin through the sebum. And so what we see here is that as you age, you start to lose your natural oil production, and you'll see here that this starts to drop off. And in fact, we've shown that if you have someone that produces, say you're at 60 years of age, and you produce more oils naturally than another 60-year-old, you have less visible signs of aging. So the more oil you produce on the skin naturally, the less you're going to age as it is. And so, and could that be because you're delivering more antioxidants to the skin? That could be one of the mechanisms. But I think it's important to realize that not only are we talking about, yes, if you go out in the sunlight, things can change. Also realize that over time, your body is shifting in its ability to produce as much vitamin E and becomes even more important, and not just vitamin E, but antioxidants becomes more important to augment the skin. So on that note, if you're thinking about augmentation with vitamin E, this was a study looking at supplementing with 400 milligrams of tocopherols, and they asked a very simple question. How long does it take for your vitamin E to show up on your face? And they tracked people over a period of 3 weeks. And you can see that even doing it for 1 week, so out at 7 days, didn't impact much change. 14 days, you're starting to see a blip. And then at 3 weeks, now you're really starting to see a shift. And so what's important to realize is if you're going to supplement, you have to commit. And I think that's the reoccurring theme that I'm going after here is that it takes time, especially when you want to put in these lipophilic agents and get them to augment into the skin. It just takes time. So what about whole foods? I mean, we've been talking about all these supplements, and it sounds like supplements may be the best way to go. Well, there are studies now looking at whole foods, and here's one study that looked at lycopene, which is a component of tomatoes, versus tomato-based foods, the whole foods. And what they found was tomato-based foods were better for LDL oxidation protection, and also for protection against protein and DNA damage. And so what's important here is that it's not just about taking a supplement, that the whole foods sometimes have other components in there that can be synergistic. And it goes back to why I showed the herbal study initially, is that there's a synergy that can come together even within one food. So this was a review that looked at multiple studies, and what they concluded was that the clinical evidence supported that tomato-based foods are better as a first-line approach over lycopene for cardiovascular health. Now, this isn't skin health that I'm looking at, that I'm showing you, but that's because there are very few studies on skin health, and I'm going to show you one of those few studies. But in general, this concept of whole foods versus supplements is not a new one, and we know that whole foods have an impactful effect on the skin, and sometimes more than the supplements. And guess what? They're probably funner to eat anyway. They have taste to them. So when we looked at, we were looking at what sort of a study could we do with nut supplementation. And the reason that we looked at nuts in general, where if you even look at the Ayurvedic knowledge, which is again the traditional form of medicine from India, there's this notion that nuts can be augmentative to skin, and they can augment the skin's ability to be protected. Now, that's traditional knowledge. What we want to do is put that through rigorous approaches and rigorous science. And then if you look at what are the different nutrient factors that are present in multiple different nuts, we wanted to really look at which ones are high in natural amounts of niacin, which ones are high in natural amounts of alpha-tocopherol, and then which ones have dietary fiber, because you can also impact potentially the gut microbiome. Now, I'm going to show you data that didn't necessarily look at that, but I'm going to talk about future studies as well. So the reason nuts are interesting is you're not just taking one thing and supplementing it. We want to try to utilize what comes out of the whole foods, and many times there are different features in there that can be impactful when you supplement potentially. So let's talk about almonds in the skin. What we wanted to know was a simple question. If you consume nuts, almonds in particular, will it slow the development of wrinkles? And the way we organized the study was that we looked at splitting people into two groups. We had people that were in the almond group who got raw almonds applied at 20% of their total daily energy. It was approximately a handful of almonds, and very easy for people to ingest. And then a control group, which didn't have any nuts in there, but was calorie matched, so a cereal bar, a granola bar, and some pretzels. And you can find this design. It's listed on clinicaltrials.gov. One of the important features that we did when we recruited for this study was that we recruited postmenopausal women who are also very sensitive to sun damage. So Fitzpatrick type 1 and 2. And the reason was we wanted to find those women that were at that point in their life where their wrinkles were starting to accelerate, and they also had skin that was very sensitive to accelerating towards sun damage. And here is the consort flow for the study. We randomized a total of 31 people in the end, and so it was 15 and 16. And in the end, we analyzed everyone with an intention to treat analysis. And you can see that by and large, for the most part, most people stayed within the study. And it was over a significant period of time. We did it over, and I'll show you on the previous slide, we did it over 16 weeks, because you can't change wrinkles within 1 week or 1 month. I mean, that's just not possible. You need to actually spend time. So here are the demographics. There was no differences between each group, about 60 years of age, and all of them were women. And that's because, again, as I mentioned, we were going after the same the same gender, but also going after postmenopausal state. And of course, can't do that with men. And then they were all about the same body mass index. The way we measured their wrinkles was utilizing a camera that's very high resolution, and you can also take reproducible photographs after they come in. You do something called ghosting, so you can put them in the same position, and it can track. It has a bank of multiple cameras, and you can triangulate, which means really pinpoint each surface contour change, and thereby be able to measure things like wrinkle depth, length, and also width. And then we also looked at blood lipids. We wanted to see, did we shift anything in the sebum secretion, and did we shift anything in the kind of lipids that are in the bloodstream? So I'll cut right to the chase. Here are the results from the wrinkle analysis. The wrinkle severity is a measure of the depth and the length. And so what we found was that at 8 weeks, you can see the control in the almond group, not much shift. But when we get up to 16 weeks, understandably, there wasn't much change in the control group. Well, what you can see is there was about a 9% shift improvement in the folks that were supplementing with almonds. And we also found that same sort of feature to be present when we looked at wrinkle width. And so you can see out here that at 8 weeks, we didn't see a shift, but at 16 weeks, we did. And again, reiterates this whole concept that you can't just do a diet or make a shift for a couple weeks or a couple months. You really have to commit to it. But if you commit to it, guess what? You get to have fun eating these really fun foods. We also looked at did the skin barrier change, and we measure this through what's known as transepidermal water loss. That's how quickly you lose water through the skin, and you use an instrument called the TEWA meter. And what we found was that there was no shift in the skin barrier at baseline 8 weeks or 16 weeks. We also looked at did the sebum levels change. It's hard to change sebum levels. Sometimes it's more impacting what's in the sebum. And in this case, we didn't see any shift in sebum levels either. No change at baseline 8 weeks or 16 weeks. These are the images that we take from before and after. And you can see these are color calibrated images, and they're put into the same position reproducibly from shot to shot. So you can really track them, and it's a standardized way of holding their face in a position. And when we looked at plasma lipids, we did not see any shift in some of the other factors like MUFAs or PUFAs. We didn't see any shift in those group of people. And then we didn't, in those measured endpoints. And then there were no side effects. Initially we thought people were going to complain about weight gain. We thought they might worry about GI upset. We didn't have any of those issues. And in fact, I do want to make this as a special point. We didn't see anyone gain any weight as part of the study. I know that this is sometimes a question that comes up. If you're supplementing with nuts, which can be high energy and they have protein in them, are they going to gain weight? We didn't see anyone gain weight as part of the study. So overall, the results in this almond study were that the wrinkles were improved in the almond supplementation group. We didn't really see a shift in the sebum production or the skin barrier, and the lipids in the bloodstream did not change. So what we're looking at, we're doing an extended study now, we're looking at how vitamin E may have shifted, if that's part of it. But remember, there are different features in almonds. I just want to point that out. We all think almonds are just vitamin E, but that's not the point. The point is that there's multiple features in there, and sometimes figuring out what it is can lag a bit behind the clinical results because it's a complex food, and it's not just a simple, oh, it's because of this one ingredient that's in there. Now what we're doing is we've expanded the population to 60 subjects, and we're evaluating them over 6 months instead. And we just completed the study. We're finishing the analysis. It will be coming out shortly, and we're going to be looking at how the gut microbiome also shifted. So we'll be looking at other features like the short-chain fatty acids and inflammatory markers that I had mentioned in the beginning to really understand the gut-skin axis components that is being impacted by almonds. And with that, I just want to thank everybody that's been a part of this study, and also all the people that have been collaborating with us, either at UC Davis Dermatology, UC Davis Nutrition, at Sacramento State. We have a microbiome research initiative that's ongoing there. And with that, I hope that this inspires all of you to look at foods as a way to really impact skin health. Whole foods can impact skin health as well. And why not have fun with eating almonds? And if you eat almonds, that's a great way to impact your level of photoaging and the health of your wrinkles as well. And I will finally say that as a final thing, the Almond Board did support the study that I presented, and so I'm grateful to them, and also grateful for the other sources of funding that we get from the USDA, the NIH, and we also do some work with the National Rosacea Society. And with that, I thank all of you for your attention.
Thank you, Dr. Sivamani. With that, we'd like to go ahead and start the question and answer session of the webinar. We see quite a few great questions have actually come in. So the first question that I'd like to start out with is from one of the audience asking that they have heard that facial expression could affect how a face changes over time. And so could you speak to any literature on that and what your thoughts might be in terms of the role that facial expression would play in terms of wrinkles, and whether or not food could be used as a way to improve that?
Well, this is a really great question, Swati. I think it just speaks to the point that our wrinkles are probably a reflection of our lifetime of expressions, especially on the face. So yes, if you are very expressive, if you're expressive happy, you will have smile lines, and those will be around the eyes and perhaps a little bit around the mouth potentially. If you frown a lot, you are going to get those 11s that are right in the middle of the forehead. If you raise your head a lot, you are going to get wrinkles along the forehead. The way wrinkles form is from motion. It's when the muscle contracts perpendicular to the muscle, your skin has to crinkle, and when it crinkles, that's when you get the wrinkle. And so expressions do lead to that. I do also try to have these conversations with my patients, is that you don't want to necessarily remove all of those expressions. If you have certain expressions, that's a reflection of just how you've been spending your life, and especially if you have a lot of smile lines. When we take an approach to aesthetics, the idea is to reduce maybe some of the aspects of aging that people don't like, but at the same time, it does tell a story. Some people don't like it if they frown a lot, so then we can help address those kind of areas. But yes, expression does lead to wrinkles. That is a true statement.
Okay, great. Thank you for that answer. I'll move on to the next one. We have so many, we'll try to fit them all in. But another viewer wants to know, how does the effectiveness differ with vitamin E in sunscreen versus oral?
Well, first of all, with sunscreens, a couple of points that I'd like to make. There are different types of sunscreens. There's physical sunscreens, and there's also chemical sunscreens. Some people split it as organic and inorganic. And what I'm referring to is chemical sunscreens are these ingredients like avobenzone, octocrylene, the stuff there. Honestly, you have to sound it out when you're trying to pronounce them. And then the ones that are not, are more mineral-based, are zinc and titanium. And what we do know is that the chemical-based sunscreens tend to absorb. There's been recent studies, but this has been known for a while. It's nothing that's really only recent research. For a long time, we know that when you apply sunscreen on your body, they're going to absorb. And many times you'll pee them out, and you're able to find them in the urine. So what I tend to tell people is to move towards the physical blockers. I prefer people to use zinc and titanium. I think it's much broader spectrum. They have clever ways of tinting these sunscreens now so they can be a better color match. Now, in terms of speaking about vitamin E in the sunscreen versus taking like a whole food supplement or supplements in general, supplements are going to give you a different approach to the skin. It's basically this idea of synergizing. So I always think it's good to always include oral supplementation or oral food choices as part of good sun protective habits. But when you look at vitamin E in sunscreens, you have to ask a couple questions. First, how stable is it? Vitamin E, by and large, is not a super stable molecule once it gets hit by sunlight or by UV in general. And also, is it going to have a function when it's sitting in the sunscreen? If it's in the sunscreen, is it going to get access into the skin so that it can actually do its thing? Because when sunlight hits the skin, it's not just about blocking the sun. We also have to realize some of that UV light is going to get into the skin. No sunscreen is perfect, because when you look at how sunscreens are applied, they're not applied the way they're usually tested. It's just not comfortable. And then you have undulations in the skin. You'll have pits and valleys. And of course, the sunscreen is going to sink into the valleys, and then into the ridges, you're not going to get as much sunlight. So then you are going to get UVA and UVB that come through. They're going to form things like singlet oxygen, oxidative stress. So is the vitamin E present there? Now, if you apply it topically, did you get it to those zones where it is? Whereas if you ingested some sort of a supplement that's rich in it, or vitamin E itself, is it going to get spread out a bit more evenly? I think putting vitamin E in sunscreens is one approach. We know there are antioxidants that are much better than vitamin E, though. Vitamin E has become the king of conversations, but there are other things that you can put in topically besides vitamin E. There's polyphenols that you can put in. There's other carotenoids that you can also include. There's anthraquinones that you can include. There's so many other phytochemicals that you can include. So I think including it topically is one strategy. I don't think it's the best strategy necessarily, and I don't think it's going to last as long protectively. I think that having a combined approach, though, it makes a lot of sense, and I think the antioxidant that you put in your sunscreen is going to have to be much more versatile than just vitamin E.
Okay, great. I think that is really great insight into whether or not it should be part of topical application. So in line with that question, I have another one on the fern benefits that you talked about. And one of the viewers wants to know, do the fern benefits occur when the fern is consumed as a whole food or when it's consumed as a supplement?
Well, that's a great question. The studies have looked at the amount that the fern is consumed at, and the studies have always been in supplement form. If you're incorporating it into your diet and getting the same load, I think that's totally fine to take that approach. If you're able to get it in like that, but all the studies have looked at it as a supplement. But I mean, what does it mean to be a supplement? You can eat it with your food as well.
Right. All right, great. That's wonderful. Are there suggestions for people who might be suffering from inflammatory conditions that affect skin health, for instance, lupus, in regards to nutrition or food recommendations?
Another fantastic question. When it comes to skin inflammation, there's so many different ways that your skin can inflame. You run the full gambit from acne to rosacea to psoriasis to, as the question was posed, lupus, which can be much more autoimmune rather than auto-inflammatory. We look at psoriasis is sometimes, it can be called as an autoimmune, but we haven't really pinpointed the exact antigen that the body's going after. So instead, what we like to say is it's just inflammation that's gone a bit haywire. Then there's also eczema. Eczema is a whole different pathway that's being upregulated. So it depends which one. Now, that being said, when it comes to lupus, they have shown that if you take supplements that can help increase, or I should say, reduce your risk for sunburns, those have been helpful in that regard. Now, in terms of actually controlling the lupus, there are a few studies that are going to actually look at set disease and following a particular diet over time. But I think if you can incorporate things into your diet, in that particular case, especially from the skin perspective, that will increase your threshold for sunburning. I think those are going to be beneficial. So, I think some of the things you'd want to incorporate are that fern, Polypodium leucotomus that I talked about, or if you're going to include astaxanthin or beta carotene or some sort of carotenoid supplement, I think those are reasonable. But you still got to use your sunscreen, and it's got to be broad spectrum. One of the the tipping points when it comes to lupus is that sometimes visible light can aggravate it. And realize that your sunscreen or anything that you're using as a sunscreen agent is usually going to block UVB and UVA, but you don't get visible light blockage unless you use tinted sunscreens that have a bit of iron oxide in there. So what I tell people to do is to use, especially if you're dealing with something like lupus, non-nano, that's really important, because when you micronize zinc, and it's kind of a misnomer when they call nano, it's really at the micron level, but when you micronize zinc, you don't block into the far into the UV areas that are right next to visible light, and you don't block that blue light that's coming from visible light. Primarily because you can't see the zinc anymore, right? If you can't see it, it's not blocking it. But I tell people to use non-nano zinc that's tinted. And if you can do that, you get a little bit better blockade into the visible region. And also I talk about supplementation.
That's a wonderful, great explanation. It's really nice to know that, micronization of things are not necessarily the best answer out there. Well, this next
let me just add to that, Swati. Micronized zinc is a great option if you want to get broad spectrum protection. It is a great option because it won't have a residue and whatnot. But in lupus, the stakes are a little bit higher, and you need to have more thorough blockade. And so in that group, I really asked them to go for non-nano.
Got it. Thank you for clarifying that. The next question is really in terms of a message that our dietitians want to hear. What message is the most motivating to patients to explain the benefits of healthy food for healthy skin?
Well, you have a couple options in life, really. You can wait till everything starts to deteriorate and then try to fix it, which becomes a challenge because some things are just irreversible. I mean, no matter how hard you try, if your collagen has broken down, your collagen is broken down. You can try to add fillers if you want. You can do resurfacing lasers. We do all these things. You can do ablative lasers. If your skin starts to thin too much on your forearms, for example, a lot of people hate that. They hate their skin getting really crepey and thin, and they bruise really easily. All of these things are better addressed with a proactive approach. And someone said it best previously when we were talking about prejuvenation. That's exactly the approach that I think foods can play, is not only about prejuvenation, but preventative actions. And so if you're just looking at it solely from a skin perspective, yes, it can impact your skin health. It can impact how your skin is going to age. You can age well. We're all going to age, but at least you can age well if you start now. Instead of waiting for a point where, oh, I better do a whole bunch of things, I think it's better to do small little things that you incorporate, get healthy eating habits in so that you make small increments of change as you go along. And that will impact a large change over years because there's no study that's going to look over years. And I think at the end of the day, for everyone listening, no matter what study is being done, the longest studies are going to be maybe 1 year, maybe 10 years, then it becomes epidemiological. But you're talking about healthy choices over 30 years, 20 years. There's no study on this. All you can do is retrospective recall studies and whatnot. But we know small increments over a long time are going to make an impact. And it's not just about skin. You're talking about heart health. You're talking about mental health. You're talking about weight control. You're talking about levels of fatigue versus how vital you feel. I mean, there's so many impacts that go beyond what a study can do. And I say this wholeheartedly as someone that runs clinical studies. We have major limitations when we just talk about studies because we're limited to what we can actually study over time. But food choices, this is a choice of how you want to live. That's much bigger impact that we can't always study all those little details in a particular clinical study. What we're actually asking our clients to do here, our patients to do here, is make a choice in themselves and their health for the future. So it's a totally different approach when we think about foods.
Right. Yeah, I think the message is loud and clear. A stitch in time saves 9. So we definitely need to be more proactive about the approach. Thank you for that. Also,
no problem. And it looks like someone wanted me to repeat the nano zinc. I'll just make a quick comment. I just said go for non-nano zinc for people that are really sensitive to light. That's all I wanted to repeat there, Swati. Sorry.
Sure. No problem at all. Thank you. Another question is regarding fiber. Could you explain how fiber improves the health of the skin in terms of dietary fiber?
Sure. When it comes to dietary fiber, we used to think that it was just insoluble and that it would just get into the gut, get us really hydrated, make sure that we stool properly and regularly. It does all those things, but realize fiber is not insoluble or indigestible. It's just not digestible by you, but your microbiome and the microbiota, which, by the way, make way more of the DNA in your body than your actual eukaryotic cells, they can metabolize that. And when they metabolize it, they can release off things like short-chain fatty acids like acetate, propionate, butyrate. And these can have indirect effects either to the local immune system in the gut and then can go do something at the rest of the body, or it can actually go through the bloodstream and get to other parts of the body. And we've done studies now looking at things like probiotic supplementation in folks with acne, and we've shown that you can augment some of their short-chain fatty acids. But going back to the fiber story, fiber is a great way to not only modulate the bacteria in your gut because they're prebiotic, but they are a source of food that then can lead to postbiotics that might have benefits in the body too. So it's definitely an indirect impact that goes much farther than just being something that helps you stool more regularly.
Okay, thank you for that. Earlier, you spoke a little bit about Ayurveda, the ancient Indian medicinal science, and it sounds fascinating. Could you talk a little bit to what Ayurveda might have to say about almonds and skin health specifically?
Absolutely. So in general, when you look at Ayurveda, it breaks down nutrition in a slightly different way. If any of you are interested in learning more about it, it's a beautiful, beautiful approach. We've created a wellness platform just looking at this as well. So, and if anybody wants more information, I can talk about that later. But if you look at Ayurveda, it breaks down what are the ways that foods impact us. And nuts in general are thought to impact us by creating an opportunity for more building. And in the case of almonds have a special place, especially in Ayurvedic. And also, if you look at Indian culture, a lot of almonds are present there. The thought is that it can help improve the status of your skin and defray aging. And in fact, that knowledge that was there is one of the reasons that, in addition to what I had pointed out with just looking at its nutritional components, it was one of the reasons we wanted to actually put this under an evaluation in a clinical study to see, is that going to hold up? And if you look at the 3 doshas in Ayurveda, Vata, Pitta, and Kapha, Kapha is what's really related to building. Vata is more movement, and Pitta is more energy. And you can map these over to conventional medicine. This is not something that's like totally separated. You can totally build these maps. What almonds do is they really bolster that Kaphic portion, and they can help you with building. And the theory is that it helps to build whatever is supposed to be the antioxidant defense systems, or if it's going to be helping stimulate the skin to become a bit more healthier in the sense of collagen. That's the theory. And what we did here was really take that theory and adapt it into a clinical approach.
Oh, that's wonderful. It's great to know that the benefits are rooted in ancient medicinal science. So a follow-up question there by one of our viewers is that you presented how consumption of almonds for 4 months made the difference that it did in skin wrinkles. The question is, if you ate almonds for 6 months or longer, would you see a greater change in wrinkle depth and severity? And that would be our last question for this webinar.
Well, we hypothesize that's the case, because we feel that anytime you incorporate foods, remember there's two main factors that you're thinking about, 2 mechanisms in how food might be helpful. One is it does a direct impact and does a direct good. So it will actually take wrinkles and reduce them as one idea. It could be, one of the impacts of food. And I'm using wrinkles as just one example. But also consider the opposite, which is that as we age, we're going to naturally change. And can foods just help adjust how we are going to change? So if your wrinkles are going to show up more and more with time, that could mean that your collagen is deteriorating at a faster and faster rate as you go along, or at a greater and greater rate. If you can defray that, then it's not just about reversing this collagen breakdown, but it's just about protecting you from having collagen breakdown. So the hypothesis would be, yes, as you supplement for a longer time, the wrinkles would improve. That remains to be seen. Good news is that we just finished the study, and we're going to figure out once we get the data together, hopefully in this next month, what the answer is for that. But from a scientific standpoint and a best educated guess, we would say eating good foods for a longer time will give you more of that goodness. But we'll see if that's true in this particular case.
Okay, that's wonderful. We will be holding our breath to find out what the results are. And with that, I'd really like to thank you, Dr. Sivamani, for the insight you've provided us. It's greatly appreciated. I'd also like to thank everyone who attended this seminar. You will be sent a short survey today, and we'd appreciate your feedback. We did realize during the call or during the webinar that there were some technical difficulties, and some of you could not hear part of the webinar. And so a recording will be available, and a link will be sent out for that as well. And lastly, a CPE certificate will be emailed to all registered attendees within the next 5 business days. With that, we'd like to thank you. Have a wonderful day.